Okay, so I'm going to show you how to use the insurance section. On your SuperMed, you see we have all these links at the top. There's a second row of links here. There's the insurance section here. Once you click on insurance section, you come to edit or print insurance claims. So this is where you go to edit or print the claims for your private insurance companies and NHIs and everything. So once you click on edit or print insurance claims, you have these two columns. There's one for editing. This edit NHIs and then edit corporate insurance claims. And then this side is for printing. So you have printing NHIs, print NHIs claims, and then print your corporate claims. If you want to export the claims as well, you can use the export feature here. So since we are talking about corporate insurance, we'll come to edit insurance claims. Once we click on edit insurance claims, you have this. So you select the date, maybe from 1st August to 9th August. This system I'm using now, I'm using some old records. So I'm going to select 2024. So 1st August 2024 to 9th August. Those are the claims I want to work on. I want to see if there are any claims and work on them. So here you can leave it as insurance type all, which means you are looking at all the insurance patients that came with insurance between these dates. If you like, you can select the insurance company itself. So depending on how many insurance companies you are using at your hospital, you have different types: Apex, Metropolitan, Nationwide, and all others. For this system, we have these insurance companies that we are using. So I'll use the all for now. And when you edit the insurance claims, as you edit them, you want to group them. So sometimes you group them under those that you have worked on already. So you have some group that's completed, some group that's halfway. Maybe you've worked on some insurance claims, but you are not finished. So you save it as halfway. And then normally, if you haven't touched it at all, we have untouched. Some other hospitals want to group them differently because different people use them. So different people edit different parts. So sometimes they have stage one edited, stage two edited, stage three edited. This is just depending on how you want to save it. And then if you work on some claim and maybe you can't, there's a problem with the claim, you can save it as problematic. Then once you submit the claim, you set it as submitted. Okay, so I'm going to look for the untouched claims now between 1st August and 9th August, and I submit. So once I submit, I'll see the claims. For my system, I only have one claim, and it was an OPD case. I can click on this button here, hide or show attendance, to show the claim that is here. So now I've seen the claim. This is the one claim I have. If I click on the patient's name, it now opens the claim form. So this claim form shows the clinician that worked on that saw the patient's name, the date of birth, everything, the hospital record number, the consultation number. And then if you come here, the attendance, it was a outpatient attendance. It was general OPD for a child. Then you can see the diagnosis and the ICD-10 that the doctor selected. You can see the investigations that were done for that patient, and the price and everything is there. So you get your pricing and everything here. You see the prescriptions as well, and when they were prescribed, the quantities that were given. If so, here for instance, they didn't serve the drugs, so the quantities are zero. If the pharmacy had served the drugs, the quantities will be given, and then we'll find the totals here. So everything is added up, and then you get the total amount that you expect the insurance company to pay your hospital. So once you are sure everything is fine, you can click on print claims to print the claim and then you can submit it to the insurance company that you are dealing with. So this is how we generate the claims. If you see any problem here, for instance, some of the drugs were not served, but you want to correct it, you can just come up here and click on edit claim form. Okay, so I'm going to edit for you to see. So once you click on edit claim form, it will open the normal interface where you edit the claim. So here, for instance, once you finish editing, this is where we change the status. So it was untouched. Maybe you've edited it and you are halfway. So if you are going to save, you ensure that you leave it at halfway before you save, so that next time you come, you can see all the claims that you left them at halfway, and then you search for them. If you've completed this claim, you can save it as completed, so that next time you come and you are searching for claims, all the completed claims will be separated, so you don't need to be going through them again. Imagine having 500 insurance claims to process. If you don't group them and save them properly, you when you come back again, you will not even remember which ones you've completed and which ones you have left out, or which one is left to be worked on. So once you finish working on a claim, you can save it as completed, or if you were doing it and you didn't finish, you can save it as halfway. The ones that you haven't worked on at all, you leave them as untouched, so that the next day you can come and work on them. And then if there was any problem, maybe you need to ask the doctor whether the diagnosis was correct or something, or maybe some drug that was prescribed, you are not sure whether that drug is matching with the diagnosis. You can save that one as problematic, so that it will be categorized under the problematic claims. The next time you come and you are searching for the problematic claims, you can just filter and get that one done. Okay, so I'm going to the investigations. Maybe the FBC was done during Aribis, and then maybe you want to add one more investigation. You can add it or edit it. So you can decide to add maybe DUE and creatinine, and then you save. In that case, you have to enter the date to match the date. This was in 2024. So you need to enter a date to match the date, so that your insurance company doesn't reject the claim. Okay, so assuming you've done all these changes and you want to save, then remember, you come to the first tab, and then here you set the claim. Okay, so now I want to leave it as halfway, or I'll come back to it, or if I'm done, then I'll make it completed. Then you save. So I'm not going to save this now because it's an old record. I don't want to edit it. But that's how you do the insurance claim. So once you've seen your patient or you searched, so next time if you come here, if it was completed claims that you want to submit, you will just filter for completed claims. Then once you select it, only the completed claims will show here, so that you can go and print only the completed claims. So I hope you've gotten an understanding of it. The printing can be done this way. Whilst you are on the patient's insurance form, you can click on print here, and then it will generate the printout, so that you print it and then you give it to the insurance company. So when you are going to give your claims, you have your claims all together printed out and given to the insurance company. If you are using RX, for instance, then you will look at this claim sheet, and then you transfer the information into their RX system. So you copy the patient's name, their first name, last name. RX has their own system, so you can open that one up on the same in another tab, and then you just copy. So FBC was done. They have their own format, so you can copy that and paste it in the urine RE. You put it in the malaria, and then all the drugs can also be done. If you want to export, I've already shown you the export section, so you can go there and export in Excel, and then you also send it to your RX. Thank you.